Well, I grew up on a small farm in Iowa. We had a few cattle, a few crops that took care of our cattle, and watching my dad kind of manage the farm, and he worked at John Deere as well and in the maintenance area where he was able to fix things. That kind of is what drove me to become an orthopedic surgeon. I went to college for chemical engineering, which again was kind of fixing things, but I realized I wanted to work more with people as opposed to machines and processes. So I started volunteering at a physical therapy office, and I really liked it, but I liked learning more about the surgeries the patients had instead of the therapy. So that's kind of what drove me into becoming an orthopedic surgeon. I did my undergraduate at Iowa State University, and then I did my medical school at the University of Iowa. Again, growing up in Iowa, it just kind of made sense to stay local. Yeah, so then I transitioned to the University of Wisconsin, did my residency for 5 years in orthopedic surgery there, and was lucky enough to be chosen as the chief resident for the year, which kind of means you have extra responsibilities, kind of managing all of the residents who are a little bit below you as far as in their training program. And then I moved from there to Birmingham, Alabama to work with Dr. James Andrews, who's a world-renowned sports medicine physician. Spent a year working with him and his partners, Dr. Lyle Kane and Dr. Jeffrey Dugas, which really was the highlight of my training by far. Working with him, learning his way he talked to patients, way he treated patients, and also his surgical technique was something that I think is unparalleled. Well, that's kind of an interesting story. So we liked living in the South, and I needed a job, so I kind of started looking around, and I talked to Dr. Kinnebrew, and I came down to visit him in Warner Robins and felt like Warner Robins had a lot to offer us. Wanted to be in a smaller town, not a big town like Atlanta, where the traffic is bad and there's other issues that come along with living in a big urban area. So I wanted someplace that was relatively small where we could become part of the community, and Dr. Kinnebrew had a good opportunity here. So I joined him about 8 years ago, and then about a year and a half after that, he and I joined Ortho Georgia and have been part of Ortho Georgia for the last 6.5, 7 years, and it's been a great working relationship. Well, growing up, I was an athlete, so played baseball, basketball, ran cross country and track. Always had an affinity towards treating athletic or even doing athletic type things. So I felt like that was something that really drew me. And then when I was a medical student, I did a rotation on the sports medicine rotation at the University of Iowa with Dr. John Albright. And we did a couple of cases with arthroscopy, and that was where we used the scope to do things. And this was about 20 years ago. So arthroscopy at that point in time had been around for a while, but was still in its relative infancy compared to where we are today. And I was hooked on it immediately. And in sports medicine, we do a lot of our surgery through the scope, using the camera to do things through small incisions, minimally invasive, so to speak. And after that rotation, I was hooked on sports medicine, and arthroscopy is something I wanted to do for my career. Yeah, I think Dr. Andrews was very instrumental and his partners as well, Dr. Kane and Dr. Dugas, in how I practice medicine today. One of their biggest things was listen to the patient and listen to what they're telling you and go beyond just their words, but what they're feeling and how it affects their life. And I think that's super important for people who do what I do, because my job is not to fix your knee. It is to fix your knee, but it's also to fix your job, get you back working. If you're a runner, get back running. Whatever goals you have, those will become my goals for you too. And that's something Dr. Andrews was really big on. He was very big on listening, very big on being attentive to both the patient and the patient's family's needs, and putting the patient first. And I think if you come to see me or choose me as your surgeon, you'll get that as well, where we are very patient focused. We'll take the time to sit down with you and discuss what's going on. And then I also give patients options as far as what your treatments are. I feel like we should work together as a team, much like Dr. Andrews did with his athletes who are making millions of dollars a year. It was a team effort, and I think that team approach really gets people the best outcomes. Well, I like to spend time with my family, and my family is really active. But aside from that, I'm very active in the triathlon and running and CrossFit community. So I've actually done an Ironman triathlon about 3 or 4 years ago. Kind of retired from that just because it takes a lot of time to train for it. But I've then transitioned over into CrossFit. But I feel like that experience has really helped me take care of a lot of those athletes in our community. I kind of understand where they're coming from, what their goals are, and how to get them back to that particular activity that they like to do, especially for a lot of the endurance and high intensity training programs that people like to do now. I think it really is something I have a passion for, and I think that passion comes through when I treat patients who have injuries associated with that.